You're live.
All right, guys, you can see my patient has now done fully non-ablative and fully ablative laser resurfacing. Hispanic skin type, ethnic skin tone. We have to be a little more cautious, although we did very deep erbium resurfacing. You can see quite a amount of blood there. And we're now applying PRP, which is growth factors from his own blood. You can also apply the B and C if you have. It's very important we get it over the areas, especially if we did the profractional laser. We want those columns to be open, to be accepting in these stem cells, growth factors, anti-inflammatory components. Turn to the left. We've planned this out. We typically add A-cell, which is a stem cell product, to also speed up the healing and prevent hyperpigmentation. And then our plan with him is we're going to be aggressive with aftercare because it's super important in Hispanic skin type or ethnic skin tone. You prevent hyperpigmentation. We don't want any long-term issues. Typically that always goes away, but it could take numerous months to do so. So what we try and do is be aggressive with skincare, and then at about days 14 to 21, we have them do a Cosmetic or an enlightened peel. Now, if my patients aren't here, we can send it to them and have them do it. It's annoying because they already were red for about 2 weeks and they were peeling, but if they do it, the end result for their skin is so much better. So that's one of the things I'm telling him to do. He came and did his second laser treatment, but at this point, we're not going to be able to see him for a while because he's going to help out our country. So what we would need to do is give him an enlighten or a Cosmetic and have him do that somewhere in about 3 to 6 weeks from now to really enhance the outcome. And then I really think he's going to get such a huge improvement. So the PRP has been added. We're now going to add a little bit of vitamin C, just a small amount into each area, and a little bit of vitamin B. All of that's been shown to not only help the healing process, but also slow down any of the swelling, any of the bruising. And then the last component to this is to add a mask, a facial mask that's cooling, because a lot of the studies show that if you do that, the inflammation risk and the redness goes down. The last component would be him to do red light at home. And then he has a whole skincare protocol on what he needs to do, and he will follow that to the T for the next 10 days as he's healing, and he will send us updated videos every day. He'll show us the skincare of what he's doing, and he'll show us what he looks like. It's going to be great. I'm very excited for him, but this is what we got to do for severe acne scars. And it's very important if you have an ethnic skin tone that you understand the process is different, especially when you're working on these types of skin and doing aggressive treatments. Finished. Cool.